Great, thanks. Thanks so much, Leslie. If you can stay there for any questions, let's see whether we could take. And I think if you wouldn't mind using a mic, if you have questions, so that if there are people online, they can still hear you. So.
Hello, great presentation. I haven't seen work like this, so this is really interesting. So when you were talking about, I think in my mind going into this presentation, I kind of had the cause and effect flipped in my head. I was thinking like, okay, if someone is needing to borrow water more frequently, that would mean that it is in a time when they have more water insecurity and therefore are more stressed. Have you thought at all about sort of the chicken and egg issue of like, is it that they're stressed because of water insecurity and then it's alleviated by the borrowing? Or I guess, how did you address confounders in that way?
Sure. Yeah. Yes and no, I guess. So of course, when we came into it, we had a hypothesis of like, this is what we think is going to happen, and we kind of started collecting data towards that hypothesis. But as we've looked at the data, we've figured out maybe we were wrong, and so we have started exploring some of those other things. And I think a lot of what I've done is just talking to the local people and asking them like, okay, I figured if you need more water, you're going to borrow more water, and you might be more stressed. Is that how you feel? And then they'll look at you and be like, are you crazy? And I'm like, okay, maybe I am. So it is something we have to tease out. We have run a bunch of analysis, like different directions in this data to try and see. Overall, we're just really not getting a lot of significant results. And so I'm thinking there's more to play here than what we thought. But with that being said, I think one of the key takeaways here is, because this analysis was really focusing a lot on that nail cortisol. The nail cortisol and the self-report measures of stress are not matching up. And so we really want to tease out what's that all about. Because, yeah, maybe the chicken and the egg's one way for perceived stress, and the chicken and the egg's another way for this biologically embedded version of stress. And so that's something else we're going to have to think about. Yeah.
We have other questions for Leslie?
Yeah.
Why 3 months?
For the fingernails?
Yeah. Why are you? What's like? How do you know it's a good estimate? So is that?
Yeah.
Like, because hair grows what, inch every 50 days or something like that?
Yeah. Well, I mean, the non-scientific answer is a guess. Everyone's nails grow at different rates, but there have been several studies that have kind of looked into this question of like, well, on average, how fast does a nail grow? And the general consensus is about 3 months. And even my data is not quite 3 months at all times, because I was trying to get out there in October and it was flooded and the cars couldn't make it, so I was a little bit delayed. I got there in November, so my data's like slightly off a little bit for matching up. So we just do the best we can. But yeah, and weirdly enough though, after you've cut a couple thousand toenails, you start remembering the toenails. And I'm like, I cut your toenails in April. I recognize your toenail. And so I know that's weird, but I can kind of see the progression of like, oh yeah, it is growing out. Like, I remember you crushed your toe with a rock last year, and you had this spot, and now it's moved, and you know. But yeah, in essence, it's based on the literature, but it is pretty much a guess. And I do want to say that the nail cortisol literature is new and up and coming. And so there is, I mean, reviewer 2 gets me. There is some questioning around whether it is a good measure or not. And that's one reason why I decided to use it plus the self-report measure, so that we're not siloed into just one measure for this. Yeah.
Great. Do we have other questions for Leslie at all? If
I'm
not,
happy to talk more afterwards.
yeah, great. Thank you so much, Leslie. Okay, we're gonna ask Daniel Wynn to come up next. He's going to be talking about fecal sludge management in humanitarian contexts. So he's turning to a very different but equally fragile environment where sustaining safe sanitation services presents complex logistical and institutional challenges. So Daniel, you can fire up and we'll get going.
Tufts University. I have not met another medical student here yet, so if you are one or if you know one, please connect with me. I'm presenting this research on behalf of my colleagues, Claire Pickens-Smoose, Catherine Dorgal, and Danielle Lantain, studying barriers and facilitators for implementing sustainable fecal sludge services in humanitarian context. So just for some background, oftentimes in humanitarian response and emergency context, emergency sanitation often takes the form of latrines or communal toilets with a big emphasis on rapid deployment in the acute setting. However, there is a great need for fecal sludge management, especially considering its implications for human and environmental health, as fecal sludge is often a vector for communicable disease. And oftentimes sanitation is often underfunded and underestimated in humanitarian response. Past literature has indicated several barriers to FSM, including a need for durable infrastructure that's resilient and passes beyond the acute phase of humanitarian response, technical expertise, operational constraints, alignment with local waste systems, and integrating new FSTPUs, fecal sludge treatment plants, into existing systems in place, and also local geography, so thinking about the soil and the existing water tables. However, there are consequences due to the unsustainable infrastructure without a focus on long-term humanitarian response, therefore leading to increased hazard exposures, ultimately compromising the health of local communities and the local environment. This research originated from the Fecal Sludge Management Technical Working Group of the Global Water, Sanitation, and Hygiene Cluster, for which UNICEF is the cluster lead agency. Together, they identified 7 research questions on how to optimize fecal sludge management planning to increase sustainability beyond the acute setting. And so Tufts University received funding from USAID and Bureau of Humanitarian Assistance to answer one of these questions, specifically, what are barriers and facilitators to sustainable fecal sludge treatment plants services in emergency response? This was a mixed methods descriptive study, starting with key informant interviews. So we conducted 20 interviews with fecal sludge management professionals who have worked in a variety of humanitarian and development responses. Some of these professionals work in advisory level positions, such as being a cluster coordinator or being a sanitation or fecal sludge advisor, as well as a variety of engineers who work in interdisciplinary fields, such as environmental, electrical, and so on and so forth. In terms of their demographics, 55% are working and are based in Europe, and 45% are based in low and middle income countries, including Venezuela, Lebanon, Jordan, among others. And we use a semi-structured guide to help facilitate these interviews. The second prong of our study included site visits, where we analyzed 18 fecal sludge treatment plants across 5 contexts, specifically in Germany, Jordan, Lebanon, Cameroon, and Tanzania, across the 3 main phases of emergency response: acute, protracted, and stabilization. For the purposes of this presentation, acute refers to kind of the days and weeks immediately following a crisis, protracted referring to an unstabilized, unstable crisis that's gone beyond the acute setting, and stabilization refers to a context that's now transitioning into long-term development and management. But for the purposes of this presentation, these results and recommendations are for general emergency response and are not specific to one of these 3 phases in humanitarian response. We also conducted site visit assessment forms, which were filled out by the operators of these individual treatment plants. Following thematic analysis of our key informant interviews, 9 facilitators emerged, and then this bar graph shows the number of mentions per theme across the 20 interviews. So to highlight the most commonly and most frequented discussed ones, starting with robust technology. So this idea of developing technology that is not only context specific, but is also resilient, kind of thinking about different types of emergencies, and it's able to be adaptable and modifiable with also strong user interface and adaptability. Similar to that, modularity of selected technologies was another commonly discussed facilitator among informants. So again, similar to robust technology, thinking about technologies that can be modified into something longer term with small upgrades that are adaptable and also resilient, going past the acute phase and moving on to stabilization. Additionally, culturally appropriate solutions were also discussed. Community engagement is very important, and so thinking about local mindsets, local perspectives, and trying to incorporate those in the technologies as well. And lastly, considering the entire sanitation chain. So from start to finish, even from the start at the get-go, thinking about sustainability and long-term fecal sludge management care, and just thinking about that from in the first place. 5 barriers had emerged from our thematic analysis of these interviews. And so to highlight the top 3, starting with maintenance difficulties. So thinking about technical gaps in terms of operation and maintenance and that level of skill, and oftentimes in communities that cannot afford this or do not have that, or have that technical gap, oftentimes that operation and maintenance has to be contracted externally, which can be costly. Going on to my second barrier, lack of financial viability. So thinking about these poor funding streams and also investor behaviors on prioritizing acute short-term care and not really thinking about sustainability. And so kind of working with investors to think about how thinking about sustainability would be a better return on investment. Lastly, fecal sludge management knowledge gap, not much technical capacity in sanitation in the first place. And now moving on to our site visits. Again, so these are our 5 contexts across the 18 site visits that we did, as well as their respective emergency phases, acute, protracted, or stabilization, as well as their respective settings in urban, rural, or refugee camps for the context of Jordan. It is also important to note that the last site visit data collection we did was the day of the project stop work order in late January. So in terms of our facilitators that emerged from these site visits, again, thinking about community engagement, Jordan and Tanzania both reported local acceptance and demand of their treatment plants. And in Tanzania specifically, they saw an opportunity where they conducted a community awareness campaign, specifically when there was increased rates of illegal desludging in this particular context, I believe in Dar es Salaam. In that particular treatment plant, the operator of this site worked together with local community members to host this awareness event on why it's important to not use illegal desludging processes, and unfortunately had to enforce a fee for engaging in that activity. Additionally, streamlined flow, easy operation and management, easy handover, and strong collaboration to local communities members in the context of an emergency when it approaches the stabilization phase of its emergency. And so in this illustration right here, we can see that this technology is very well labeled. And so in context with low technical capacity, local community members are able to understand this very easily. Effectiveness in general was also a key facilitator. So in Germany, short implementation time, a limited need for power in Jordan because of self-sustaining power, modular adaptable technology. So again, thinking about resiliency and technology that's easily adaptable depending on the context or the type of emergency that's being experienced, and also strong performance, with Germany, Jordan, and Lebanon reporting their site visits exceeding or meeting their dedicated indicators. And lastly, self-sustainability. So reusing outputs in Cameroon and Tanzania and selling outputs to local farmers. So in this picture on the right, we see an illustration of Tanzania's, specifically Dar es Salaam's, fecal sludge treatment plant, and we see that the treated wastewater is actually used for irrigation of banana trees. Discussed barriers include space constraints, especially in urban, peri-urban, and refugee camp settings in Cameroon, Tanzania, and Jordan. So lots of heavy, large machinery that's very constrained to very small spaces. A lack of coordination and leadership. In Germany, where there was a big flood, a lot of stakeholders were involved in this acute response, and so there was just confusion on who was responsible for what, as well as a lack of national standards. Local disconnects, so a lack of community engagement in certain contexts. In Jordan, we saw that a major source of fecal sludge was actually from hand washing facilities, because we saw that Jordanian women in these refugee camps were using hand washing facilities to bathe their children. And so thinking about these considerations and preferences locally. And as mentioned, the illegal desludging in Tanzania and not using public resources in Jordan. Resource constraints in Germany and high costs in Jordan and Lebanon. And lastly, toxicity. So thinking about pollution in Germany and Jordan contexts, as well as material corrosion. So here on this bottom right, we see a buildup of a lot of pollution from the treatment plant in Altona, Germany, which experienced an acute crisis. And since, as I discussed before, there were a lot of stakeholders involved in this acute response, it was unclear who was responsible for cleaning up this pollution and making sure it wouldn't seep out into the local environment. And then with material corrosion in Lebanon, we see that this material has been quite rusted. This is kind of inevitable in fecal sludge management just because it's an oxidative process in nature. but just thinking about the sustainability of the type of materials we use to build these resources, so it's not corroded, and not damaged from the wear and tear over time. Overall takeaways, thinking about, again, engineering modular technologies that are context-specific yet adaptable, are resilient and can last beyond the acute and protracted phases of an emergency, are low maintenance, and minimize the space taken. Strengthening financial mechanisms and convincing donors that it is a better return on investment to invest in sustainable fecal sludge treatment plants, and emphasizing that these contexts have to do a trade-off between short-term affordability and long-term sustainability. Community engagement. So in Dar es Salaam, we see the use of these briquettes. And so thinking about local preferences and cultural considerations if fecal sludge is even culturally accepted in this context. Long-term forward thinking and reusing, selling final outputs. As discussed in this refugee camp in Jordan, this slow sand filtration filter was used to treat water that was then used to irrigate these crops. And also building leadership capacity and partnerships to, have dedicated land, establish national standards, have access to these resources that'll allow for the success of these treatment plants. And so overall thoughts, we're in a crisis with emergency funding, and so there's a big emphasis on short-term and life-saving measures only from the US and other high-income contexts, and so thinking about how we can emphasize sustainability, convincing donors and talking to them that it's a better return on investment to invest in sustainable and long-term fecal sludge treatment plants and emergency response. And next steps, all this data has been collected, and we are now writing up the manuscript for it. With that, I want to say thank you all for listening. Thank you to USA, BHA, especially Tracy Wise, key informant, interview informant, site visit hosts, the Sandy Hub Research Committee, and Danielle Lantain, who is on the Zoom right now. With that, I'll take any questions.
Okay, we have questions for Daniel? Yeah. I mean, I think if there are colleagues online, it might be good. Otherwise, it's a bit difficult, isn't it? Thank you, Leslie.
Hi, thank you. Great presentation. I'm so glad that you were talking about the illegal dumping of fecal sludge in Tanzania, because when I saw that picture you had of the tanker at the beginning, that was my very first thought. I was like, oh, I know where this is going, because I have a little bit of experience working in peri-urban Tanzania. And so that got me to thinking, though, you talk about these emergency management situations and how they're very all boots on the ground quickly. But I was wondering, did you think at all about creating like an SOP, like a standard operating procedure, some kind of training or document to implement among your partners so that the next emergency situation that comes up, you don't have this scramble of who's in charge of what, who's gonna do what. And then you don't have these people slipping through the gaps, doing the illegal activities that are exacerbating the emergency situation instead of perhaps helping that situation.
Yeah, that's a great point. Thank you for sharing that question. So in an ideal world, hopefully these fecal sludge treatment programs are sustainable and long-term enough in partnership with local governments and local stakeholders and bodies that, and also thinking about working with donors and kind of investors to make sure that these are in place, to the fact that like illegal sludging may not be necessary because like that is widely acceptable and accessible to local community members. If Danielle is on the call, I'm curious if you had anything else to add.
I don't think she can unmute.
Oh, I understand. Yeah, but thank you for that suggestion. That's something we'll definitely consider in our future research.
Yeah.
And as we expand this. Yeah.
Hopefully you can find some funding other than USAID.
Yes, of course.
Thanks so much for the presentation, really interesting. I'm wondering if you can talk a little bit more about the engineering modular technologies, like some examples of what that might look like.
My background is in public health and medicine, so I'm not the best to answer this, so I could rely on my colleague Gabrielle, if you would be able to answer this if possible.
Yeah, I think one of the things would be thinking about like having systems that are going to be kind of flexible across different types of spaces. And if
specific. But thank you for your question.
I had a quick question. So if the stop work order hadn't come about, what would have this developed into, and what would have been the sort of main deliverable or output from it? Who would have been using that?
Mm-hmm. So let me go back to that slide. Here. So from my understanding, I joined this project a bit late, but my colleague Claire, who was on the ground in Lebanon collecting the last fecal sludge treatment plant data in Lebanon, and then received notice that the stop work order was in place and that she had to stop her work immediately. Yes, that was a very unfortunate situation. I think we wanted to visit even more site visits and then collect enough data from these different site visits so we can stratify, especially with the phases between acute, protracted, and stabilization.
Mm-hmm.
I think just with the data we have been able to collect prior to the stop work order, we don't think that the amount of data we have is viable to make that type of analysis.
Mm-hmm.
So that's something we definitely would have wanted to consider.
And then can I add one more thing? So Danielle just texted me. She wanted to help answer the first question that you had, Leslie. That SOPs were part of the original part of the grant, which of course
Right.
didn't end up moving forward. But that coming out from this, in addition to the output manuscript, will be SOPs and dissemination through cost.
Okay, great. Thank you. Okay, well, let's thank Daniel again. And if we can then ask Rochelle Frounfelker to come up. She's going to be talking about the situation in South Sudan. You're going to bring the discussion back, I think, to the human scale, talking a little bit about how WaSH Insecurity intersects with distress, fear, and dignity in conflict-affected communities. So, Rochelle, over to you.
Yeah, do I maneuver this?
Gotcha.
I'm not seeing it on the screen.
Yep, so it's only on this screen,
Oh, okay. All right, well then that was right. Okay.
and then
I
you can just go
didn't-
left and right.
Okay.
Or you can use the clicker here.
Yeah,
There you go.
okay. Thank you. Hi, everyone. Congratulations, we're at the end of the conference. We've made it. The other good news is I'm not a WaSH expert, so you have all smoked me on that, right? But I say that in seriousness to say, to frame this, in my perspective, I'm a social epidemiologist with a focus on mental health of displaced populations and war affected populations, and also background in transcultural psychiatry. So my expertise in mental health and thinking about that, and so that is the focus of my work, and wanting to pair that with someone like Gabrielle who focuses on WaSH work and thinking about these things together, right? What are the mental health impacts of WaSH insecurity? So overview today, your classic presentation, background, protocol, results, and discussion. Not a big surprise here. Thank you. I know the first presentation there was a definition of water insecurity, and and again, I think we all are pretty familiar with this, but just say broadly, what do we mean in our work around what WaSH security is? And at the same time, also saying, what do we mean by mental health and well-being? Because those can be understood and measured in many, many multitudes of ways. So we're thinking about mental health as certainly concrete diagnoses, right? Mental health conditions, including mental disorders. But also thinking more broadly about psychosocial well-being. And for this study, we more broadly talked about psychological well-being because of much of the stigma attached when you say mental health, right? People are typically going to think of sort of a psychotic disorders, and that isn't what we wanted people to be thinking about relative to this work in the community. So we focus more on a general idea of psychological well-being. So the setting of our work was in Juba, South Sudan. It's a bit of a fuzzy picture, but there's a little yellow star there that shows the local community we worked with on the outside of Juba. And this was a community that was identified by Oxfam and another local partner on the ground in Juba as a sort of a semi-rural, pretty rural community that good size, that would sort of fit the kind of work we wanted to do over a couple weeks in this setting. Our overall goals and aims was broadly our goal was to understand specific to this community in this area of the world, in Juba, South Sudan, what is the relationship between WaSH Insecurity and psychological well-being from the perspective of individuals in this community, and aiming to explore how do people understand what kinds of WaSH Insecurity did they experience, how did they understand the relationship with their psychological well-being, and also within this, thinking about and exploring gender differences and how people understood these ideas and relationships. So the method we use, and if anybody here has heard of concept mapping or used concept mapping, it's a good time, I highly recommend. But in essence, what you see on the right is an image of sort of a final product of concept mapping exercise, where you literally have a visual map of different ideas that people have generated themselves and their understanding of the relationship between these things, right? And so participants, in order to get this map, are involved in 3 rounds of data collection. In our study, our goal was to have 2 separate groups of men and women to generate ideas and how they visualize them separately. So very briefly, our group sessions then, in the brainstorming session, the first one, we're asking everybody to generate and just brainstorm of ideas related to the topic, which ours was WaSH and mental health. And after there are no new statements that are generated, we took that data back, we refined it, we reduced duplicates, things that didn't really weren't relevant or made sense, and had these final list of items. Our questions for the brainstorming was separately to ask, identify a water issue that impacts psychological well-being. Then we did another round saying, how about sanitation? And a final round asking about hygiene, right? So people could think of these things perhaps separately. We know they are interrelated, but to isolate them in their thinking as they were going around. After the brainstorming then, we went back with this data for both men and women groups, translate these ideas to English because the data was collected in Juba Arabic by local research assistants, remove duplicates, merge similar ideas. And then this is a community of people who are not literate. So we also have to take all the statements and ideas generated from these individuals and create flashcards. So what you have that Gabrielle gave to you was a WaSH and mental health hieroglyphics with a couple examples and the answer key on the back of some of the flashcards that we came up with for both men and women in that handout. You want to take a look at that. Here are a couple examples. So getting water from boreholes at night can lead to rape by men, and that causes stress. So we spent time then transforming all these statements into picture images. Then we brought those pictures and those flashcards back for a sorting and ranking exercise. So here's an example. You can see pictures of the flashcards. And individually had individuals look at all these cards and group them in ways that made sense to them. Anyway, as many stacks as they wanted. They couldn't have, with some rules, you can't put everything in one stack, and you also can't have individual stacks for each items, right? And then we record how each participant is grouping these things together. After the sorting is when the magic happens. We input this. We use Group Wisdom is software that you can purchase specifically for concept mapping. Do statistical analysis of that, generate maps, analyze this, and make some decisions as a team for the number of clusters and the maps that we have for both men and women separately. And then the final round, the third round, again, and we're going back to the same people each time, right? Be like, remember us, this is what you told us, right? And asking the group to reflect and look at the groupings they themselves came up with, and for us to ask them to interpret it for us, right? Like, how do these things go together? What is your understanding? What is your takeaway, right? What would you need to address these issues? And so doing that, individually focus group sort of format, and we did ask participants to then individually vote on the clusters and their level of importance, and which cluster was most important to them. There are some issues in the way that, some bias in the way that data was collected, and peer pressure. So we don't present those results here. It was nothing much to hang our hat on. So, briefly, our results. So these are overall the participants. We've separated out clearly with women and the men. Just some general basics, things of note, certainly in terms of the vast majority had children, which was something we were interested as well, right? Were they thinking about children when they were giving us their answers? What we also were interested in the residential status, were they from the host community, were they returnees, were they refugees themselves, marital status, employment, and their amount of education. Now for the more interesting, this is then an image of the men's concept map. So total they gave us 53 different ideas and they were reduced to 33. So when they did the sorting and the grouping, they grouped together these 33 ideas. So just as a brief sort of exercise to walk through, on the upper left, you'll see a cluster that included all the positives of WaSH. Like what are good things and positive outcomes of having enough water, sanitation, and hygiene, right? And not surprisingly, when people sorted them with the flashcards, they sorted all these positive things together, right? So that was we identified this as positive impact. But then you can see in the geographic location, let's say, of statistically, those cards were sorted together very far away, very infrequently sorted, what we see on the lower right, which are clusters that formed around the idea of being stressed up, which is sort of a local term they used for being stressed, and dirtiness, not having enough water, and lack of WaSH services. When we asked them their interpretation, these are some of the statements they made to understand this. They said, I'm not okay because of the flooding, we can't access other places. We go to the riverside and we're worried about gangs and being assaulted. And here are some of their identified needs. I'm hitting the 2-minute mark, gotcha. So now, the women's concept map. So it's amazingly, sometimes gender does matter in terms of how people think about these things, right? And so for women, you notably see, yes, there are similar things like stressed up, and they also identified positives, but specifically they identified things related to shame, right? Around menstruation in particular, frequently. They were the ones that identified things related to gender-based violence, right? And dangers that they might have, and diseases, and how they thought about these things and how they were grouped together. And then in their conversations and interpretation, women did talk about these different things, right? About fear of being sexually assaulted, fear of their children being assaulted if they went to get water, feeling shame in front of other people, or if they didn't have the menstrual hygiene project that they wanted. And I like this last quote at the bottom because it's also it's sort of the positive thing around water, sanitation, and hygiene. And they talked about how great it was when they could go get water with all the women would go together. And it'd be like their big opportunity to talk to each other and hear what was going on and gossip and get advice from one another and things like that. And here's where sort of some of their identified concrete needs. So overall, to round it out, I think a couple things here. One, people haven't done it or thinking about what are methods we can use that are participatory methods to hear from people themselves locally of their understanding of the relationship between WaSH and health outcomes. Here specifically, of course, mental health. I think concept mapping is a great thing to do. And it's something I would certainly say is, we certainly had to adapt the methodology to work with a population that was not literate. And so there were very typically what you might do with concept mapping else in other situations, we didn't do here, right? But to basically say it can be done, right? And people understood the flashcards. In fact, I think they themselves were a bit surprised. They're like, oh yeah, I told you this the other day. We're like, yes. I think there is potential for, if you have larger samples, to stratify things more than gender, right? Which we didn't have the ability to do that. And so thinking about, again, to be able to think local knowledge and local understandings. And I think one nice thing here is also asking them to identify solutions, right? And they had a lot of ideas, and you could say some of them maybe were not realistic. But again, it's sort of, you're hearing from them, getting their ideas, and asking them to be part of the discussion about what could be done. Acknowledging our funder was at Lehigh University, our local WaSH actors, Oxfam and SpedUp, our local research assistants who had to learn this all very quickly on the ground in South Sudan. And here's the QR code for a published article that came out earlier this summer with the full information if you're interested. So, yeah.
Okay, we'll take some questions for Rochelle on her presentation. South Sudan.
Yeah.
Thank you for the presentation. I'm not quite familiar with concept mapping. Could you please explain to me what distance between the clusters and the size of the clusters mean?
Right. So yeah, that's a really good question, again, because you don't have the time to go into the full analysis, right? But I'd say, so you're doing like a hierarchical cluster analysis where the statistics are evaluating how many times people paired items together, right? So if things ended up being paired closely together, all the items around shame, where like people very frequently put these items all together, right? And you can evaluate clustering from like 3 clusters up to 10, 15 clusters even. And part of that is evaluating as a research team what is sort of value added with more clusters or what kind of distills meaning from it, right? And so, yeah, so it's basically looking at correlations between items and how frequently they're clustered together amongst all those participants then, yeah. So for like, at the end of the day, if you look at the raw data for each pair, it'll tell you how many times they were put together in the same stack, if that helps, yeah. Yeah.
Really interesting concept. I was wondering about the time it took to kind of engage the community for this entire process. If you could talk a little bit about that. I know some communities like we don't have time to answer your 20 questions, but I was wondering.
Right, no. But that was certainly, I would say, that was sort of on the ground adaptation also as we saw how things were unfolding, right? No, so I would say the sort of what you'll see in the textbook brainstorming should take you 90 minutes. No. This was like at least half a day, right? So that was like, we went out in the field for a full day, and Gabby and I split up. I worked with the men, she worked with the women, right? And also with the men, we were lucky in that there were a couple men who could write, and so they were able to kind of be note takers for separate groups, but that wasn't the case for the women at all, right? And then when we came back with the sorting, that was another thing too, where we kind of realized they're going to have to do it individually, but also to get the instructions one by one, or at most 2 at a time. We had 2 stacks of each card deck, so that also was like 5 hours or something for everybody to get through it. And then when it came to the interpretation, trying to do that as more of a focus group setting, so it took a bit less time, but still, I think, just sort of how they wanted to have that discussion. And in the men's group, for example, they decided for each cluster, people wanted to get up individually and make their declaration. These are all related because. So like one by one, you're like, let me tell you what I think, right? Well, the women were very different. So yeah, it was definitely time intensive, right? And so needing to have a community that is able to come back, right? I'd say total we were in South Sudan for over 2 weeks, right? Because you're thinking about collecting the data, in between analyzing the data. We had to make the flashcards and then go out, So all of that process was time intensive, yeah.
Okay, thank you again, Rochelle. And our last speaker, not least, is Gabrielle String. She's going to be talking about a related line of inquiry and sharing some insights about WaSH practitioners and researchers and how they see the link between service insecurity and mental health. So, Gabrielle, over to you.
Excellent. All right, I am literally the last session before the poster session and happy hour. I would encourage, though, we're all going to do a short little exercise, so if you could all stand up. And I want you to stay standing if you have worked on water, sanitation, or hygiene insecurity in some way. Okay? Stay standing if you have worked on mental health. Okay. And stay standing if you know what the Frounfelker's ecological systems model is. Oh God. All right. Excellent. No, that's super helpful. Okay. So my name's Gabrielle String. I am here today presenting on behalf of Katie Blomqvist, who is the MPH student who is the lead author on this research, with Rochelle and myself. Okay, so we've talked a lot about WaSH Insecurity today. Knowing that I was the last in this session, I sort of cut all of that out to think about why are we really here thinking about mental health. So 970 million people are living with a mental disorder, and that accounts for about 418 million DALYs, right? So this is a huge burden. And we know that there are a wide range of determinants of mental health, including biological, psychological, and social. So one question that we had was, how do WaSH experts globally understand the relationship between WaSH insecurity and mental health or psychosocial well-being? So we really wanted to target that. And why are we thinking about this? Well, we know that there has been a lot of work recently in the area of insecurities, but one of the things that we felt was missing from this literature was being able to capture what WaSH expert experiences were. So that is why we conducted this study. So our methods were to do key informant interviews via Zoom, and we recruited anybody who self-identified as a WaSH expert with knowledge of mental health in low-resource contexts. We did this through a series of LinkedIn recruitments, listservs, email contacts, and snowball sampling. And we had a semi-structured interview tool that we utilized. All of our data from our transcripts we analyzed in MaxQDA, and we did a content analysis of this, which means that we did inductive coding through repeated close readings of the transcripts, and between the three of us, we always had independent coding, and then we would come together to resolve and to find agreement on the way that we were defining our code book. At the end of this, we then grouped everything by theme. There's a second piece to this as well, and that was to really evaluate what pre-existing WaSH insecurity frameworks were. So there are some that link different aspects of mental health and WaSH insecurity, such as those by Wutek et al. And Mushavi et al. And then we also looked at Bronfenbrenner's ecological model of human development, which I'll come to at the end to showcase what we have put forth as our model. So in total, we talked to 19 participants. 12 people identified as female, 11 people had a terminal education as a master's degree. Really interestingly was that 14 of the respondents to our call had worked in the WaSH sector for more than 11 years. And the work setting here, we would ask, what was your experience? 11 of our participants worked only in the development context. None of our participants had spent their careers in the humanitarian sector only, and 8 had worked in both settings. You'll notice that these don't add up to 19. That's because people have moved around over their careers. So I think it's really important to understand what the sector was for employment for folks over time. You see a lot of the people we talked with had experience in international or national NGOs, academia or consulting, and also in government. And then where were they reflecting on their experiences from? So again, this adds up to more than 19 because people worked in multiple regions of the world. So we had a lot of folks who had worked at some point in their careers in sub-Saharan Africa or Central and Southern Asia, but we also spoke with people who had worked in Latin America, the Caribbean, as well as the focus of their WaSH work being in Europe and North America. So our results, this is sort of our high-level analysis of our results. We clustered into these 4 categories. So we're going to talk about WaSH insecurity and psychosocial stressors, the multi-level impacts of WaSH insecurity, the interconnectedness of these stressors across ecological levels, and then the roles of WaSH and mental health practitioners to address this topic. So first off, what do I mean by WaSH insecurity and psychosocial stressors? So examples that we had coded, for instance, of physical stressors would be this statement here. So transportation of fecal waste, carrying water, carrying sanitation, having to walk long distances to look for water are all causing physical stress. What was an example of financial stressors that were described? As this quote is showcasing, it's talking about people having to pay for the distance that they're going, particularly when water sources have dried up, and what that looks like in terms of amount that people are paying compared to how much people are earning for income in a day. And then lastly, what are social stressors? So this is an example of how we would code a social stressor. So there's no privacy. Most people have a pad that they have to wash, so that's not that's minimal hygiene. And then there's a lack of privacy in small homes, and the routinization of this creates a sense of self-humiliation. So that's an example of what would be considered a social stressor. Okay, so what about the multi-level impacts of WaSH insecurity? So scarcity forces regular individual and household decisions to be made between resources. And we saw this coming up in quite a few of our interviews. And this example describes a woman who makes tamales and sells tamales in the local town. But to make the tamales, she needs a source of clean water. And so when money is tight, they can't go access the water because it's a whole driving and hauling process. And then when it comes down to a financial stressor, they're thinking about, do I use that money to buy water, or do I use that money to buy medicine? And added on to all of that, the medicine makes me thirsty, so then I need to buy more water, right? So really we're thinking about all of these insecurity impacts as being multi-level. Another example was that insecurity is compounded by systemic issues like land tenure and infrastructure distribution, both between and within communities. So this first example talks about how in Bangladesh, people have to buy water from cellars, and the way that the cellars operate in kind of an organized crime kind of way causes the amount of money to fluctuate that they're being charged and required to pay. The second example talks about how within the United States, in certain places you can have homes that have their own well, their own septic, it's fully functioning, and then right next door within the same community, how neighbors may experience different types of WaSH insecurity with broken systems. So again, thinking about these as multi-level impacts. The next area was thinking about how these are interconnected, so how the stressors are interconnected across ecological levels. So we know that physical, financial, and social burdens overlap, and they reinforce each other, which kind of creates this web of challenges. This was an example from someone who was working with health centers and talking about how the health center, if it's not clean enough, people are concerned about how they would be able to be treated entering that health facility. And then there's this perception that patients or healthcare providers have about patients because of cleanliness, and so because of hygiene. And all of this then can relate back to trust, right? We saw this come up again in an interview, again with healthcare facilities, talking about shame from healthcare workers needing to ask pregnant women to bring water with them to the health facility. And so again, we're seeing an interconnectedness of these stressors across levels. So thinking not just about an individual, but an individual and their relationship to others, and sort of up through the systems of how communities are connected through the stressors. And then lastly, we asked during our KIIs, we asked, again, WaSH practitioners, what the role of WaSH practitioners is to address WaSH insecurity and mental health. And we had a lot of rich data to sift through here, and I would say it could be summed up as people talking about a need for a shift in WaSH practitioners from purely technical infrastructure approaches to more holistic, people-centered approaches that would then consider mental health. But there was significant uncertainty and ambivalence about how WaSH actors should go about this. There were descriptions of needing diverse teams, but of noting that there's limited financial availability to create these diverse teams, or having the expertise to be able to address mental health if you are a WaSH team. There were some references to potentially referring people onward to other services instead of provisioning happening as part of a WaSH system. But overall, I would say that one thing that we could describe is that there was quite a bit of uncertainty in how WaSH practitioners were thinking about their role in addressing this. We also asked WaSH practitioners, well, what do you think the role of mental health practitioners would be to solve this question? And there was, again, some uncertainty and ambivalence around not really knowing fully the role that mental health actors could take, and recommending the need for more cross-sector learning, right down to like even understanding language and definitions. What do we mean when we say mental health? What do we mean when we say stress? Another was a recommendation that basic WaSH has to be tackled before we can address mental health issues. And again, this is coming from the WaSH practitioner side of thinking about mental health practitioners. And a call for collaboration more broadly to address the issues of poverty between both sectors. And then thinking about how mental health practitioners could be integrated into WaSH planning in the future. So we took all of this really interesting data and we developed from it the WaSH ecological stress model. And so I mentioned Bronfenbrenner's ecological model. So in the center would be self, and then as you move out, you have your microsystem, which is your direct relationships with each other. We move out to the mesosystem, and that's going to be how those microsystems interact, right? So as we move out from self to, we can think about household, community, chronosystem around the outer edge is going to be through time. And one of the things that we did here was we defined these social stressors, financial stressors, and physical stressors as being interconnected to each other, right? So that's represented by our arrows that are going around. And then across ecological levels, right? Sometimes things that happen at the household are going to have relationships to things that are happening at a community level, right? In the way that those stresses play out. But there's fluidity in saying that it's not just a financial stress, it's not just a physical stress, right? We often have multiple stresses here. And what we really liked about proposing a model of thinking about WaSH insecurity and mental health in this way is that it's taking a systems level approach. And really what we're talking about here is WaSH insecurity existing within a system. Okay, so what were some key takeaways from this work? So one was that a systemic and sustained response is needed by policymakers to consider how we might integrate mental health and WaSH. That could include allocating dedicated budget lines to this, collaborating with other sectors so that we have a coordinated approach, or developing frameworks that outline standards for guidelines on how to integrate, right? We've done that for things like physical health outcomes, so thinking about mental health outcomes as well. And then at the operational level, moving towards more people-centered, holistic WaSH approaches, and really importantly, focusing on co-designing interventions with communities to ensure that we're meeting all needs, including those psychosocial needs, right? And that has been something we've heard in the WaSH space about co-design over the last decade or so, and so really thinking about moving that further along. So with that, I want to thank you for your time and attention today. I really appreciate it. I'm happy to take any questions.
Okay, questions to Gabrielle.
Hello. Very interesting talk. Thank you very much. Could you clarify, just at the beginning, your population that you did your informant interviews with? Because I think I was a little confused as to what, like, for example, what countries were they from?
What countries were they from? We had people from all over the world.
Okay.
And we had people who had worked in places all over the world as well throughout their careers.
Okay.
So when
They
we
do
were,
have to know English.
they had to know, I was going to say, they had to know English, have access to Zoom, consent, obviously, to participating in the research work.
Okay, but like representing both like low, middle, high income areas.
Yes.
Yeah. Okay. Cool. Thank you.
Great. All right. I'm not going to hold us up certainly any longer.
Okay, well, I mean, I would encourage everybody to speak with the authors afterwards, also with a glass of wine. So, Gabrielle, I think you'll be available to go into more depth with your model and results. Thanks, everybody. I appreciate the chance for our presenters to share their insights with you.